From Pitești, Romania. Day 2 of being on the road. Actually, day 3, we were traveling the first day. Day 3 of being on the road with Team Greece. Some issues have come forward, as is to be expected on such cases. So I'm now with one of our athletes. He's very kind. I've asked him, to assist me in this communication with you, this live video. And he has an issue. It didn't happen during the games here yesterday or anything. It seems to have happened maybe 10 days ago, something like this. So through a contact with a defender, things, let's say, kind of moved around since he doesn't have a proper diagnosis. But it sounds like something like ligaments or so on. Either way, I'm not going to diagnose it, but I am going to discuss with you what is interesting regarding the elbow joint. So I'm sure all around the world you would agree that the tuberosity of the fifth metatarsal is the elbow joint. Now, my athlete describes that the ligaments, the arthrosis, the joint, something's going on there. It's not that neoskeletal. And he is describing, the tendons. His mindset is around golfer's elbow or tennis elbow. So this, in an orthopedic reflexology approach, I would be very interested, besides the reflex zone itself in classic reflexology, but in an orthopedic reflexology approach, I would be interested in the joint and the ligaments in the area of the cuboid, the base of the fourth and fifth metatarsal, all right, the way they sit. And I remind you that the tuberosity is a bit in the air. The fourth is on cuboid, the fifth half on the cuboid, the other half in the air. That's why it resembles, the tuberosity resembles the elbow. So I'm thinking about these ligaments, and already you can see, if you've done our training or if you're interested in coming to Athens this spring to learn this approach and this stuff, the anatomy. So I'm mobilizing and not manipulating the fifth metatarsal now with the cuboid, now the fourth metatarsal with the cuboid. Yeah, just pushing around the fourth and the fifth between them. So in a reflex approach to the ligaments and the joint. Regarding tendons, I will use my foot model. On the lateral aspect, we will find the tendon of the abductor digiti minimi. So there's a tendon here, and I will glide across the bone on the lateral side. So one tendon you can find here. On the anterior part, we will find tendons like, most importantly, digitorum longus, extensor digitorum longus, the branch for digiti minimi. So this would be another tendon for the arm. And going down plantarly, working on the plantar aspect, the tendon now for the flexor digitorum longus, the branch of the digiti minimi. So these are just tendons in the area, same structure in the hand. But in an orthopedic reflexology approach, I will work out the ligaments, keep those in mind, and the tendons. Of course, when the athlete describes which part of the hand has the pain, I will place the Chinese meridian. So I will ask my athlete now, is it more medially, laterally here, or more medially?
Inside.
No. Here.
Yeah,
all right,
here,
excellent.
there.
So here would be the meridians of the heart and the small intestine. So I could add these reflex areas also. Check out for any positive reflexes. And this way I bring in classic reflexology, orthopedic reflexology, and Chinese medicine. Have a great day. Have a great year ahead of you. I have a bit of traveling ahead of me. Look at the details below if you want to follow the training in Athens. Take care, everyone. See you soon.